Hi, my name is Amber Boyd. I'm a family nurse practitioner from Albuquerque, New Mexico, and this is my clinical teaching project plan. Okay, today I'm going to be covering a teaching project plan on treating hypertension in primary care. Oh, sorry. There we go. Okay. So my first slide is on needs assessment, the background. Hypertension is one of the leading causes of cardiovascular events such as stroke and ischemic heart disease. In the United States alone, there are approximately 67 million adults who have hypertension, and it is approximated that more than half of those are untreated. It is responsible for approximately 12% of consultations in primary care alone. Needs assessment for gaps in care and clinical learning needs. These vary throughout clinical practice. We're always having changing guidelines. In fact, in the fall of 2017, the JNC8 put out new guidelines. Insurance and prescription coverage options are constantly changing, and we are overall lacking patient education programs and follow-up initiatives. So what? Well, streamlining clinical practice in the treatment for hypertension has the potential to allow for a safe patient care, increase patient compliance and satisfaction, decrease cardiac events and hospital-level care, and an increase in disease management in the primary care setting. Description of our learner for today is going to be the APRN, or Advanced Practice Registered Nurse, who is an adult and graduate level learner, typically has a master's degree or higher, is practicing in family practice or primary care, and it's important to note that race, gender, and experiences may vary. Our goal is that the master level APRN student will identify and apply an updated practice intervention for clients experiencing uncontrolled hypertension in the primary care setting. Objective number 1 is to identify evidence-based guidelines that provide strategies in recognizing at-risk hypertensive clients by utilizing current research and literature sources. Mastery of the skill set will be measured by a post-discussion with preceptor and presentation of the literature review. Objective number 2 will be to demonstrate strategies to integrate relationships between social, cultural, economic issues, and personal beliefs within the healthcare delivery method while treating patients with hypertension. Student development of a skill set will be assessed through a mock interview and role play exercise. Objective number 3, upon appropriate symptom-based recognition of hypertension, the APRN student will determine a correct diagnosis and will act upon this information by providing treatment and applicable plan for follow-up. Assessment of the student's plan of care will be measured by correlation of a graded case study with an 80% accuracy or better. I chose the following methods for instruction. A case study. Case studies can be utilized in various methods to facilitate learning principles. They promote critical thinking and apply knowledge to real situations. Utilizing case studies can allow us to measure and evaluate the learner and apply their knowledge and make realistic decisions. I also chose role play. Role play scenarios give the learner time to practice verbal and physical interactions in a controlled environment. And lastly, the third method of instruction will be a literature review because it provides the learner with a broader perspective of knowledge already obtained in the clinical space. This also will allow for different perspectives, and it allows for self-initiative to broaden their knowledge. The review of literature. This is article number 1. It's titled Using the Flipped Classroom in Graduate Nursing Education. The purpose is utilizing an autonomous approach to encourage accountability and retention in nursing education. This was achieved by flipping the classroom and having the cohort prepare prior to class with readings and modules, and then meeting in a Socratic setting for discussion. The method, authors compared the experience of a cohort of students who participated in a flipped classroom, they were the intervention group, to a previous cohort were taught more in a traditional method, and that was the control group. The results was that satisfaction from survey responses varied, but all participants passed their courses with a C grade or higher. The conclusion is that the study added to the nursing literature and suggested that flipped classroom does indeed help promote both short and long-term retention of key medical surgical content. This was level of evidence number 3. Article number 2 is titled From Role Play to Real Play, Teaching Effective Role-Playing Facilitation Skills. The purpose of this article was to utilize a survey type of study. They used a role-play technique in a classroom setting that evaluated the application of clinical practice for nurses. After a provided workshop, including role-play exercises, the cohorts were given a survey to evaluate their knowledge base and self-reflection. The results of this study were at the end of the sessions, 90% of the participants felt more confident in their ability to use role-play as a teaching tool. And the conclusion on this was that groups of 3 to 5 participants provided the best experience in role-play instruction and gave learners the opportunity to each have experience. The study concluded that role-playing is an efficient tool and communication strategy for nursing education. This was level of evidence number 4. Article number 3 is titled The Use and Effectiveness of Actual Learning Methods in Nursing and Health Professions Education, a Literature Review. The purpose of this was to find evidence of the use and effectiveness of active learning methods such as role-play and case evaluation in nursing and the health professions, as well as major knowledge gaps. The method was a meta-analysis that was conducted to evaluate research in 22 studies between the years of 2000 to 2012 on the effectiveness of active learning methods in nursing and health professions. At the end of the sessions, 90% of the participants felt more confident in their ability to use the role-play as a teaching tool. This is level of evidence number 1. All right, article number 4 was the establishment of evidence-based practice competencies for practicing registered nurses and advanced practice nurses in real-world clinical settings. Proficiencies to improve healthcare quality, reliability, and patient outcomes and costs. The purpose of this was to utilize periodic competency courses to evaluate and educate nurses practicing in the clinical setting. The goal was to develop a standard set of practices. Their methods and results, 2 standard sets of competencies were developed and utilized. They were then compared to see which was more effective and standardized the set of core competencies as their institution standard. Their conclusions decided that the standardization of education provides an institution with solid objectives and ultimately improves patient outcomes. This is level of evidence 3. Synopsis of the literature review. APRN education is multifaceted. All 4 articles present varying education methods for providing APRNs. Role-play was essential for practicing interactions and most helpful for utilizing communication in patient care. Case studies broaden clinical knowledge and experience, bringing clinical situations in an educational setting. This is also a great method for evaluation of clinical decisions. Pre-course readings and literature reviews provide the APRN learner with independent study time and skill, encourages different opinions, and broadens knowledge on patient care approach. Utilizing postgraduate education competencies helps to facilitate continuing clinical and didactic knowledge. This ultimately improves patient outcomes and quality of care. Methodology selection. Utilizing multiple methods for delivering instruction, data, and knowledge allows for variation in learning styles. Role-play was chosen to allow for the APRN interaction in the classroom setting. The case study evaluation was chosen to simulate real-world situations, encourage practice application to likely scenarios, and the literature review was chosen to encourage self-study among APRNs and also provided the APRN with different clinical practices. Integrating learning theories. I chose constructivism because I believe that you learn through experiences, learning through interaction, and utilizing real-world problem solving requires reflection, blah, blah, blah.